Hello everybody, welcome to another episode of Learn with Lo. Are you guys pumped or what to continue to build on this functional testing conversation? I've gotten so many great DMs and awesome questions behind the scenes. I still have even some more questions in my DMs to answer, so if I've left you hanging, it's okay. I'll get to you. We'll post it for other people hopefully to share as well. But I think you guys have really been taking to and relating to this conversation around labs and functional labs and kind of going from practitioner, doctor to doctor, provider to provider, and maybe not getting answers when you know that there's something that's just not aligning, something's not right because your symptoms in your body are talking to you on a consistent basis. So that's where really wanting to dive into this conversation around functional lab testing and how it's a little bit different than just conventional lab testing, and that giving us some really good stepping stones then to be able to discuss some of those individuals that feel like they've gotten kind of tossed to the side or dismissed by conventional medicine because they go in and kind of get, your basic run-of-the-mill lab work and are told, everything looks normal, and we can give you this prescription, or we can do this, or we can do that, but it's not really anyone helping you get to the root cause of your symptoms or help you decide and discover how do all of these symptoms kind of fit together, right? So when we have these conversations around functional lab testing, we've been able to really take a whole different approach to medicine and understand that there's a whole nother side that sometimes we're not even made aware of. And that's where I want to really bring that to light for you guys, because there is a whole nother world of really digging in and not just looking for like diagnostic, put you in a box, put you in a label type of labs, but looking for root causes, looking at your system and metabolism as a whole, and looking to see like how are all of these symptoms fitting together, and then what tools do we want to bring in to make sure that we're looping the most specific picture for you. So always know that a lot of these conversations that I have with you guys on Learn with Lo come from real life topics that come up in a lot of my one-on-one client care, and some things that happen behind the scenes too. So I know if 1, 2, 3, 5, 10 people I'm having the same conversation with on a consistent basis, then I know that there's more people out there that probably also are struggling the same and also have similar questions as well too. Obviously, I can't dive into as many specifics about what we're going to do about it on this platform because I am not your provider, but for the individuals that I do work with on a consistent basis, we are able to not just like establish what those root causes are and give them validation to what they're experiencing, but then the fun part is we get to put together a game plan, and I really get to walk them through that process of completely changing various aspects of their life and showing them that they actually have a lot more control over the outcomes of their day-to-day wellness than they thought they had. So if you've been following along with us in this month of September and my journey of talking about these functional labs, you've gotten to follow along as we first discuss kind of what I call like the hype and the hazards behind functional labs. I think there's a lot of practitioners that are utilizing functional labs correctly, and then I think that there's a lot of practitioners that are not utilizing functional labs correctly. So it is not all glamorous out there, and even if you feel like you've kind of experienced a functional or alternative approach, I guarantee that you haven't, because there's really not two practitioners that practice exactly the same. So that's where I think we got a chance to really discuss like the ins and outs of what is functional lab testing, what are the different options out there, from stool samples, saliva samples, dried urine analysis, more in-depth and comprehensive things that we can measure in serum or blood, but a traditional or conventional practitioner isn't going to run those things, right? Because they don't really have a treatment strategy or a pill to give you for that. But then we also got a chance to discuss like how to use functional labs correctly, and what types of situations those really come in and can save the day for us too, and give us some great direction. And then last week we talked about how we use functional labs in my practice to develop and discover someone's unique metabolic phenotype. And that's really just a fancy topic and term that I talk about with my individuals to help them really recognize like you don't fit in a box, right? And that's probably one of the biggest, like I will step up on a soapbox and scream it from the rooftops around how much that is apparent in not just conventional medicine, but also functional medicine as well. So when we discuss this concept of metabolic phenotypes, it's really coming to the table and helping individuals understand, hey, there's no two bodies that are completely the same, and to just say, oh, you have this symptom, so you belong in this box, or you have this lab marker, so you belong in this box, and then there's one treatment, one prescription, one protocol for that particular box, and then what if that doesn't work for that person, right? It's like we just have so much of what I call that cookie cutter medicine or that template medicine, that one size fits all medicine that's happening, and it's a huge disservice to individuals. And so that's where talking about and establishing this concept of like, oh, so my healthcare provider should be helping me identify what is my unique metabolic phenotype and should be helping me dive into what that actually looks like, not just putting me into a box and shoving me one direction. Yeah, that's really what should be happening. So many of you really resonated with that idea of metabolic phenotypes. And I think that's because unfortunately, more and more people have experienced this box phenomenon that has happened with not just conventional, but also functional medicine as well too. So, you know, there's so many different examples of this. And I think like the first ones that get thrown under the belt or thrown under the bus is more of a conventional aspect, right? Where we know that the medical model of today is really designed for like acute care situations, right? Like my limb is falling off, somebody help me, right? It's like, absolutely, that's where our functional medicine system really thrives, is in more of that acute or urgent care situation. But when it comes to like preventative care or overall wellness, longevity, health span, not so much, right? Because they're looking for a box, right? So a lot of times it's like, we're looking to draw labs and place you in a category of like, you have diabetes, therefore you get metformin. Right? It's like, it's just like an if this, then that. And it's like we've aligned a whole medical system around it, and it's really a huge disservice to people. Whereas we can't like always identify someone if they don't have like full-blown diabetes yet. It's like, what if they're trending that way? What if their fasting blood sugars are gradually going up? What if their fasting insulin is through the roof, but you didn't even measure that, and you're just going to sit here and wait for this individual to become full-blown diabetic so you can put them in that box and then put them on metformin? It's like, what happens before that? Because that progression we know now that progression takes a solid 10 to 12 years, right? What are we doing in the 10 to 12 years that leads up to that box, right? So that's what I'm talking about, is there's individuals that are going to go into their primary care provider. They know that they don't feel well. They know their body is giving them signs and symptoms of that on a daily basis, but they don't fit in that diabetes box yet. And so it's just like a ticking time bomb, and we're just going to let you cook on that instead of coming in and being like, oh, I'm noticing what this metabolic phenotype is. Your fasting insulin is trending high. We're trending towards insulin resistance. We're trending towards high fasting glucose, right? It's like, these are the types of interventions that we're going to start to do now so that we don't get to that predetermined box. And we see this so often. I mean, the biggest one right now is the whole obesity epidemic and obesity crisis. And this just like irks me so much because I see it daily in my practice. But how many individuals go to their primary care provider, or even you go on the internet, right? And anybody that has any struggles with their body composition or struggles with their weight immediately gets put into eat less, move more. Right? They immediately get put into the category of like, here's some Ozempic. And it's like, oh my gosh, like I'm going to leave that for a whole nother time to just like go off on that whole situation. But it's just like, I've seen so often where individuals come to me and they have beat themselves to death trying to eat less, move more. And they actually are gaining weight, gaining body fat, feeling worse, getting farther away from their goals. But yet every time they go into their doctor, they're made to feel like they're not doing it well enough. they're not doing it hard enough, or you must be cheating, right? Because this is the box for obesity, or this is the box for body composition. And if you say you're trying these things, but they're not working for you, then it's you that's the problem. Right? You didn't do it hard enough. You didn't do it right. You cheated, right? Because if you did it according to this box, then it would work, because that's my box and that's my protocol. They only have like one tool, one box, one protocol for something like weight challenges or obesity, when I can tell you right now, sitting in my spot and having 12 plus years of experience working with individuals, there's probably 15 different metabolic phenotypes that can contribute to body composition change or weight loss resistance. It is not one box, right? So if we just sit here and continuously try to push people into that like one box, they're left tossed to the side, they're left feeling dismissed, they start to internalize and be like, well, it is me, my body is broken, right? And it's like, that's not the case, right? And that can be very, very defeating, and it can discourage people from trying at all, right? So it's just, I mean, there's lots of different situations. It's like you go in and you get diagnosed with like PCOS, here's birth control. Oh, you have infertility struggles, here's IVF. Oh, you have acne, here's spirolactone. It's like everything that we do is just like box pill, box procedure, box protocol. When in reality, it's like, isn't there a bigger picture here? What is the deeper metabolic phenotype that we're looking into? Because I guarantee that a lot of people, you push them into this box and it's either not what they wanted. It's like, I'm not interested in that treatment or that protocol. Do you have anything else to offer me? And they don't, right? That's where the downfall comes in. It's like, okay, I maybe understand that I might have this PCOS metabolic phenotype, but I'm not interested in birth control. What else can I do? And they're like, well, I don't have anything for you. You have to take that. Right? It's like, that's their box, that's their protocol, and they don't have any other options. Versus in my situation, I feel like a real provider is like, hey, yep, this is the metabolic phenotype that we're coming up with. We could go this direction, we could go this direction, or we could go this direction, or we could use a combination of the three. What feels right for you? Wow, what an empowered conversation, and more of like a teamwork decision that happens in that situation, right? So don't just think that conventional medicine are the only ones that struggle with this like whole box mentality. The functional world is flooded with it too. And so that's why what I mean when I say individuals that feel like they've tried functional medicine in the past and haven't felt success, you haven't probably tried all avenues of functional medicine, right? Because it can be just as rampant in that world as well too. Like I see all the time where individuals will come in, it's like, oh yeah, I was told that I have estrogen dominance, so my provider gave me some DIM supplementation. I'm like, oh, okay, like, was that even appropriate? Did we even run the right labs, or were you just symptomatic of like hot flashes or fibroids or fibrocystic breasts or heavy periods, and like they just gave you DIM? What if you were actually low estrogen, but they didn't even test that, right? Or see like, what is your estrogen detoxification pathway? It's like DIM is an appropriate supplement for a very specific like situation, right? So it's like, that is rampant too. And they're like, yeah, that didn't work for me. I'm like, yeah, that's because that didn't fit your profile. Or, oh, I was told I have SIBO, so I need to go on a low FODMAP diet. I'm like, low FODMAP diet is literally just a Band-Aid, and SIBO is a secondary condition. Why do you have SIBO? What is the terrain in which SIBO was allowed to flourish and thrive? Because you can't eat low FODMAP forever, or you're going to destroy your gut microbiome and your mental health in the process. So it's like, and SIBO will just keep reoccurring again. So we have to ask bigger question, why? Or, oh, I was told I have IBS, so here's some food sensitivity testing. It's like, IBS is not a result of food sensitivity, and food sensitivity testing is going to light up like a Christmas tree if you have IBS. It's like, that's not the reason why we have that picture, right? Or like, oh, I told I have low testosterone, so I went on hormone replacement therapy. It's like, okay, that's one avenue that we can go down, but did we discuss like why? Like hormones are reacting to a bigger picture, so are we supporting other pieces of the puzzle in the process, right? So I just don't want you guys to think that, like I said, that this whole putting people in a box and assigning one protocol and one prescription and one avenue is just a conventional medicine or like a big pharma type thing, because it is truly not. It is rampant in both sides of functional and conventional medicine. And that's just because we have so many people that are jumping into the field, I think wanting to help, but not really understanding what that capacity actually looks like to be that person that's putting everything together for individuals and not just handing out another protocol or another kind of pill for every ill. It's got to be a total body type of approach, and not every provider or practitioner is either educated in how to do that or really has the desire to do it. They just want to kind of churn and burn according to more of like either a time efficiency or some sort of monetary model, right? So I'm not saying that, like I said, some of these like putting people in a box and giving them a set protocol and solution, I'm not saying that that doesn't work for some people, because it absolutely does. But it's probably only, I mean, I'd maybe give it a 50% chance that someone's going to be like, oh yeah, I got this diagnosis, I was given this protocol, and then I got better. Okay, cool. But what about the other 50, 60% of the people who get put in that same box, but that same protocol doesn't work for them, right? Now we get into this whole rigmarole of them getting tossed to the sides. They're told their labs are normal. You know, I don't have any other resources for you. They're kind of gaslit into thinking like, oh, it's all in my head, or it's all stress, right? Or like I said, they're told that I physically have had individuals that came to me and said like, yeah, my doctor told me that I must not be following what she told me because it didn't work. I'm like, that is just gaslighting to think that like somebody didn't like protocol hard enough or diet hard enough according to the recommendations, right? I'm like, no, it probably was just a box that didn't fit you, right? But before we go and kind of like rage against the medical machine, both functional and conventional, I really do come to the table and zoom out, being in the midst of this field myself, and understand like it's really no one's fault, right? Your body's not broken. And it's one of those things where I think a lot of times providers and practitioners really kind of do the best that they can with the information that they have at that particular time. So when I kind of think about why this is so rampant, it's because we have a very, I think, early and limited understanding of exactly what we can see in certain labs, right? So when we think about, you know, more of a traditional or conventional medicine approach, there's only going to be certain things that we really can see on blood labs and other things that we're not going to be able to really see or identify. So we either need to be really good at digging back into someone's health history, family history, genetics, current dietary patterns, past dietary patterns, stresses, traumas, things like that. We either need to get really good at digging back and putting the pieces together, and or we need some other tests and functional practices to really loop in to complement this approach. So when I think about traditional blood work, I do think that there's certain factors that we can see on traditional labs. I do think that we can see a pretty good look at thyroid function. So if someone is specifically curious about how their thyroid is functioning in the grand scheme of things, I do think that that is really well done on like a serum or a blood panel, barring that we order the right labs, right? Like just a TSH or just a free T4, that is not a thyroid lab. And we're not going to see a whole lot of anything. Like if we're going to see thyroid labs, we need TSH, free T3, free T4, thyroid antibodies, reverse T3 at the minimum, maybe even throwing in total T3 and T4. Some practitioners like to use T3 uptake. So there's like a solid 7 markers that your provider is going to want to order in labs in order to be able to see a full thyroid picture. But I do think it can be done in blood work and in traditional labs. I do think another thing that we can also see is blood sugar balance, specifically someone that's trending towards like chronic blood sugar highs. We can run things like fasting insulin, fasting glucose. We can run things like hemoglobin A1C. We can see things like triglycerides. We can look at, markers of overall inflammation as well too, to kind of see how their body's responding to an overall like blood sugar or kind of like metabolic load in that regard. And then I do think that we can also see like micronutrient status. Again, if we know what we're measuring and knowing what we're looking for, whether that's, vitamin D status, we can, a B12 status, an RBC magnesium, electrolyte balance, things like that, right? So if we're looking for specific micronutrients, that can also be something that we see in the blood, barring that we order the right labs. Honestly though, outside of those areas, it can be difficult to really see some root causes and start to put the pieces of the puzzle together, especially if we either don't have comprehensive blood labs or we're coming in and not really having someone that helps us understand the big picture or how all of these pieces fit together. So unfortunately, if the root cause of your dysfunction isn't in one of those three areas, it's not your thyroid or blood sugar highs like pre-diabetics or an overt micronutrient deficiency, we probably aren't going to see it on blood labs, right? It's not going to be in your practitioner's wheelhouse to identify anything outside of that because they don't have something to do for it. It's like, if I can test vitamin D and then put you on vitamin D, cool. They have now like a reason to measure your vitamin D status, right? But otherwise, a lot of it really comes down to those are the individuals that are easily getting tossed to the side. Those are the individuals that are easily getting dismissed because there's really maybe three different metabolic phenotypes that we could see on a blood lab. But outside of that, it's like, what about the other 35 different metabolic phenotypes that are out there and could be contributing to why I'm feeling the way that I am or struggling to feel the way that I want to feel. So don't think that just because you can't see your symptoms or your root cause of your symptoms or how things all fit together, or you haven't found a provider that's really helped you identify that from like blood labs or serum labs, I do not want anyone out there to then take that and internalize that as if those symptoms don't exist then, right? It's like, well, my doctor said everything was normal, and so I guess it must just be in my head. It must just be stress, or it must just be, I'm making it a bigger deal than it is. Maybe I'm not really that fatigued, right? I don't want you to think that then these symptoms only exist in your head just because you're not seeing them on a traditional blood lab. We're better off now starting to think outside the box and call upon some things like functional testing to be able to really identify maybe you're one of the other 35 different metabolic phenotypes, and on your blood labs, all we're seeing and being really able to identify is 3, and you don't really fit into any of those boxes. That's okay. There's still help out there. It just means that we need to kind of think outside the box a little bit. So when I start to think about functional testing practices, I would say, and these extend well beyond like, there's lots of, I think, many other metabolic phenotypes that exist under each of these 3 umbrellas. But I would say there's 3 specific hormonal profiles, there's 3 specific areas, 3 specific conditions, which we can't really see on blood labs or traditional lab markers. And this is where some of the functional labs really shine. So this is what I mean by, hey, if your labs are coming back as normal, does that just mean that everything's normal? No, it probably just means that what you're experiencing maybe can't get picked up immediately in blood work, or that practitioner didn't really order very in-depth blood work to be able to give you those straight answers. So when I think about where are kind of the metabolic phenotypes where we want to lean into more of functional medicine testing, I think about three main areas. Number 1 would be adrenal health, and specifically the role of stress, and specifically the role of this hormone called cortisol. So when we start to think about, can you throw a cortisol reading on a blood lab? Of course you can. And I do it too. And it's really just to rule out extremes, right? Is it really freaking high, or is it really basement bottom low? But I'm not really using it to make any clinical judgment or clinical protocol off of it. Is part of the bigger picture, right? If we truly want to get to the root, or we suspect that somebody has a lot of adrenal issues, or stress or cortisol related issues, we probably want to go into some more functional labs for that, right? So just as a little bit of a higher education here, the adrenals are going to be at the foundation of our hormone hierarchy, and it can impact all of our other hormonal systems, which is why I say a lot of times this can be a culprit of other issues happening with the thyroid, with the gut, with the sex hormones, but we haven't really taken an opportunity to see that because we've just been relying on blood labs, right? So the adrenals are going to be a foundational one. The main adrenal hormones that we're talking about here are going to be cortisol. We have free cortisol, we have metabolized cortisol, and then we also have another hormone that comes out of the adrenals called DHEA. That is going to travel and then feed into specifically our sex hormones of testosterone and estrogen, right? So you can start to connect the puzzle. You're like, oh, so if I got adrenal issues, I probably got sex hormone issues. Yes, ma'am, you probably do. So cortisol, though, is a tricky one to measure in blood because it is what we call a diurnal hormone, meaning it follows the light and dark cycles of the sun as it should, and it's also very much connected to acute or chronic stress. Things that we do in our day-to-day to like shift it away from the natural light and dark cycles of the sun. So cortisol should make a nice robust rise first thing in the morning. That's what's going to kind of give you that pep in your step, but then it should fall as the day goes on, right? So individuals that don't have a lot of energy in the morning, they're very achy, their joints hurt in the morning, they feel low mood, they feel depressed, they feel anxious, they struggle to get out of bed, they rely on caffeine, or they feel tired and wired and can't fall asleep. Like those are individuals where I'm like, I think we need some deeper like adrenal and cortisol testing. And for these individuals, the gold standard here is going to be utilizing salivary testing, like saliva samples, or a dried urine test over the course of multiple time points of a day in order to see like free and total cortisol production, as well as how your body is metabolizing it as well too. So there's multiple different companies out there that have these types of tests. Now, you normally, I think certain websites you might be able to source it as like a consumer, but you may not know what the heck to do with that information. So when I order salivary testing, I go through either Dutch, I go through Genova, lots of different companies where we can actually send a kit to you and collect those salivary samples over the course of the day. You send the kit in, we get the results back, and then we review them together, right? That's kind of part of a bigger plan that we implement some of the salivary testing. So I would say salivary or dried urine analysis testing is going to be like gold standard there for cortisol issues, right? Moving to kind of the second condition in which we can't really see in lab work or blood work very well is going to be gut health and gut issues. Not a surprise to most people, I'm sure, but we don't really get to see what's happening in the gut in blood. Doesn't really surprise a lot of us, I know, but when we think about people that are struggling with overt GI symptoms, whether it's chronic constipation, loose stools, urgent stools, multiple food sensitivities, reflux, indigestion, or in general, even like mood changes and mood disorders, also skin issues, eczema, psoriasis, acne, rosacea, and anyone struggling with like an autoimmune disease or autoimmune diagnosis. Lots of different picture there, but usually when I see those types of individuals, I'm like, what's happening in the gut, right? We can kind of see the things that could be influencing the gut, right? Some of the adrenal and blood sugar balance and thyroid and things that we can see in blood labs, but a lot of individuals that have like GI issues, sometimes it doesn't even manifest as GI symptoms, right? So I named off like the skin and the mood and the brain fog and the memory changes and autoimmune, like chronic pain, things like that. So it doesn't even have to be like GI symptoms to really dive into the gut. So unfortunately, though, like I said, there's not a whole lot that we can see on blood labs, maybe besides like running a CBC with differentials on someone, which would include like neutrophils and basophils and eosinophils, like some of the white blood cell count. We can look at that on labs, but again, doesn't really give us a whole lot of insight into like what the heck is going on like in the gut itself. So gold standard here would be doing some stool testing, or we could look at like some organic acid testing to really look at exposures to like toxins, molds, things like that, and or doing like a Zoomer test, which is a more sophisticated peptide level form of like food sensitivity and intestinal permeability tests, right? So it's like if someone's got issues with a gut, it's like I'm probably not going to see what I need to see in blood labs. I'm probably going to be digging into like stool tests, organic acids, Zoomers, things like that, right? The very third category that I think is important to kind of recognize we can see very limited in the blood as well too is going to be our classic sex hormones. Specifically as we're looking at how sex hormones fluctuate for women throughout their menstrual cycle or how the role that they're playing in their overall fertility journey. So sex hormones are kind of funky in the fact that, I mean, and all of our hormones do this, but sex hormones in particular, they pulsate throughout the day. Right? So even on the same day, you could measure two different time points in the bloodstream and they could be drastically different. You could measure your testosterone at one point in time and then measure it 30 minutes later, and it could be the difference between 750 and 350, right? It's like hormones pulsate and they fluctuate throughout the day. So we know that, and that's okay. It's one of the limitations of labs is that we're looking at literally like one time stamp point here. And then we think about women, and sex hormones really fluctuate throughout the month for women. So not just throughout the day, but throughout the month as well too. So to see things like sex hormones in the blood, we really need to know like what day are we measuring? Are we getting like multiple time points and kind of taking those into considerations and not just like taking face value at like one random timestamp of like, what was your estrogen? It's like, probably isn't super helpful without the context of like where are you at in your cycle, are you male, female, things like that as well too. There's also a really big difference between measuring like absolute amount of sex hormone in the body and then being able to see like what is that hormone actually doing in the body. Is it binding to receptors? How is it being metabolized? And just like I said, kind of seeing those things mimic each other can be really, really important. So some signs and symptoms of low estrogen are also some signs and symptoms of high estrogen. High estrogen can also look like low progesterone. So it's really important that we understand like what are we actually seeing here and not just going based off of symptoms all the time, because that could lead us down the wrong path if we're not careful with it as well too. So for best accuracy, you do need to know like what day of the month are you testing for women if you're going to use serum samples. You also want to know like if they're on any, hormonal birth control or any hormone replacement. That's going to be really big as well too. So gold standard here, if you really wanted to look at sex hormones, you're going to want to be specific and make sure you're measuring at a certain day of the month or about 5 to 7 days post ovulation for women, which then requires women to actually track their menstrual cycles, which is super important. And also know when are they ovulating as well too. So just knowing your body and kind of knowing your data. So gold standard here is probably going to be more of your dried urine testing. Same company, the Dutch testing, is going to take multiple time points throughout the course of a whole day and then average them for that particular day, 5 to 7 days post ovulation. So you're not just getting one time stamp, you're getting okay, throughout the course of the day, how does her progesterone pulsate and what's the average? Throughout the course of the day, how does her estrogen pulsate and what is the average? How is her body metabolizing those? What's the liver function look like? All of that fun stuff as well too. So when I think about the world of functional testing, don't make it feel overwhelming. Make it feel something that feels hopeful, especially if you're the type of person who feels like you've kind of been through the rigmarole of some conventional labs or just some super basic blood labs, and you feel like the practitioners that you do have in your corner have kind of put you in a box, right? And it's God, they keep trying to push this on me, or they keep trying to push that on me, or they tell me that well, that's my only option. And it's I would encourage you to think bigger, because what we know about the human body is there's really not one similar metabolic phenotype across all individuals, even if you're struggling with similar symptoms, right? It could look like different root causes for each of those individual people. And especially if we're thinking outside of a thyroid dysfunction or a high blood sugar pre-diabetes situation or an overt micronutrient deficiency. Those are kind of the three that we might be able to identify more in a conventional lab panel. Outside of that, if we know it's I think I got some adrenal issues. I know that I have some stress and cortisol issues. I know that I have some gut issues, and I know that I have some sex hormone imbalances because my menstrual cycles are wonky, crazy, and I don't think that this is normal. Okay, then we probably are going to need to look outside of just traditional blood labs and really work with a practitioner that knows how to use the right labs at the right time. I'm not saying that blood labs are not helpful. They absolutely are. I use them all the time, but they're not sometimes like everything for everybody, right? That's what I want to speak to that other 50% of people out there that feel like I didn't quite get the answers that I was looking for with just that approach. So if that sounds like you guys know the drill. You know where to find me. Head over to my link in my bio on my Instagram. You can see all sorts of opportunities to get engaged, work with me, get more information. You can get a link there over to Renew University, where I house all sorts of courses, programs, and downloadable documents, as well as a link to apply to work with me one-on-one, which is where I tap into these functional labs for individuals as well too. So be on the lookout for more opportunities to get involved. I have lots of fun stuff I'm working on behind the scenes, but otherwise come back for more Learn with Lo in the future, and don't hesitate to drop questions here if you have them. Happy Monday.